Hello everyone, I'm Professor Jonathan Glassard from Edgehill University, and I'm going to talk to you about a whole school approach to mental health and well-being, but I'm also going to talk about mental health and well-being as a student in higher education. Okay, so the reason I've chosen to focus on schools is because many of you are coming into study education. So some of you will be coming and training to become teachers. Some of you will be choosing other education degrees. Many of you will go on and have careers in education after you finish your degree. And therefore, that's why I'm focusing on the role of schools in supporting children's mental health and well-being. But at the same time, I'm also very aware that you're coming into university, you're about to transition into university, and I'm also going to therefore talk about your mental health and well-being as well. Okay, that's the plan. Okay, so first of all, we're going to just think about what well-being actually means. Okay, so well-being is a broad overarching concept, and what you can see here from this diagram is there are different dimensions to our well-being. So we can think about our physical well-being, how physically active we are, for example, our social well-being, so how well we socially connect with other people, and whether we have access to friends and good social relationships. We can think about our emotional well-being, our mental well-being, even our spiritual well-being. So well-being is quite a broad concept. And also these areas are not distinct. So for example, our physical well-being also supports our mental health. Okay, so if you're physically active, then we know from the research there's a good link between physical activity and mental health. And we also know from research that if you have good social connections and you have good friendships and you're able to talk to people and interact with people, that also supports your mental health and well-being. Okay, so these areas do actually overlap. Okay. So we're going to talk about transitions because many of you are about to transition. You're about to go from either school or college to go into higher education. Transitions are the ability to adapt to change. So it's how well somebody actually adapts to a change. Now, what we know is that some transitions are positive, and hopefully you'll move into university and you'll all have positive experiences. So some transitions are positive, but other transitions may be negative. Okay. And when people experience negative transitions, that is potentially when people can experience poor mental health. Okay, so we've got to think about transitions and how transitions link to mental health. What we know then over the last 15 months or so is with the global pandemic is that children and adults have experienced multiple transitions. Okay, so we've all had to get used to different ways of learning, different ways of studying. We've had to get used to maybe reduced social contact. We've experienced social, academic and psychological transitions. So many people have been worried about the ongoing situation. They've been worried about the pandemic. They've been worried about the virus. They've been worried about members of their family maybe becoming ill. So we've gone through a time of significant transitions. We've all experienced multiple transitions. And I know from the students I work with, at university, many of them have been really, really resilient during the last 12 months, and they've kept going. They've progressed through their studies, they've got their degrees, and they've done really, really well. But they've also found the last 12 to 15 months quite difficult as well, because they've missed coming onto campus, they've missed face-to-face teaching, they've missed face-to-face interactions with their tutors. All of these are really, really important to support our well-being, and they've missed out on the student experience as well. So hopefully things are changing, and in the autumn term, things are going to be opening up, and you're going to be able to go to university and enjoy the student experience and enjoy face-to-face teaching, enjoy those interactions with tutors, and enjoy meeting each other as well. So we're coming out of this situation, and hopefully things will improve. But I'm going to argue that well-being is an urgent priority at the moment in education, both for students in higher education, but also for children in school. There's lots of talk at the moment in schools about providing children with a catch-up curriculum. And I think it's exactly the wrong focus. I think what children need at the moment is a well-being curriculum, a curriculum that supports their well-being, a curriculum that supports their mental health. I think that's really, really important at the moment. And then the academic learning will follow from that. So in terms of mental health, I think it's important to understand what we're talking about. Okay, so everyone has mental health. Okay, so mental health exists along a continuum of, you imagine like a line, and we go from being mentally healthy, we can go from being mentally healthy at one end of that continuum, right the way across to being mentally ill. Okay, and then we can go back again, so we can fluctuate. So our mental health can change. We can go from being mentally healthy to being mentally ill, and we can go back and forth along that continuum. But I'm just going to use this definition from the World Health Organization, who define mental health as a state of well-being in which individuals can realize their own potential, they can cope with the normal stresses of life, they can work productively and fruitfully, and they can make a contribution to their community. And I like this definition because this definition describes a mentally healthy person. Lots of definitions of mental health go straight into describing mental ill health. But actually this definition is describing what is a mentally healthy person, someone who can work productively and is able to make a contribution and able to get on with things. And I like the definition also because it helps us to differentiate between maybe someone who is experiencing a low mood and someone who is depressed. So, for example, someone who is depressed may not be able to cope with the normal stresses of life. They may not be able to work productively. They may not be able to make a contribution. If they're depressed, they might not be able to do those things. But actually, if they have a low mood, they may have a low mood, yet they may still be able to cope with the normal stresses of life and make a contribution and be productive. So I think it's a good definition because it helps you to draw the line between maybe somebody who's got mental ill health and maybe somebody who's experiencing low mood. So why is this a priority at the moment? Okay, so it's a priority because we know that 1 in 10 children and young people will experience a mental health problem. So 1 in 10. We know that roughly 850,000 children and young people have a diagnosable mental health condition. We know that 45% of looked after children also have a diagnosable mental health condition. And we know that some children, such as LGBT young people, are more likely to experience poor mental health. So we know that some children are more vulnerable than others. We know that most of the problems start before the age of 14. And if they're not treated, if they're not supported, some of those problems can go on into adult life. So the sooner children can get intervention, the better. We know that mental health is complex. Okay, so we can think about what are the risk factors. Okay, so what factors put people at risk of developing poor mental health, but also what are the protective factors. So some of the problems are rooted, or some of the factors rather, are rooted in the child. Some of them are rooted in the family. Some of them are rooted in the school. And some of the factors are rooted in the community. So we know, for example, that children with disabilities are more likely to experience poor mental health. We know that children who are brought up in households where maybe they experience parental conflict or abuse or neglect, for example, those children are more likely to experience poor mental health. Children who are exposed to parental criminality, for example, are more likely to experience poor mental health. We know that school and schooling can also be a cause of poor mental health. So, for example, if children experience bullying in school, that can lead to poor mental health. But also the curriculum, if children are given a restricted curriculum, or if children are exposed to exam stress, for example, that can cause poor mental health. And we know that some of the problems are rooted within the community. So, for example, we know that children who are born into poverty, social deprivation, are more likely to experience poor mental health. And within each of those domains, if you like, the child, the family, the school, and the community, there are risk factors and protective factors. Okay, so I think it's important, this slide, because it helps us to understand that the causes of poor mental health are not simple, they're actually very complex. Okay. This is called the biopsychosocial model of health. And what this shows basically is that our health is affected by biological factors, social and environmental factors, and psychological factors. And what you have basically right in the middle of those overlapping circles is you have mental health, which shows that our mental health is influenced by all of those different factors, by biological factors, social factors, environmental factors, and by psychological factors. So I quite like this model as a theoretical model because it's just illustrating that actually this is a complex issue. And in terms of students in higher education, now this is showing that between 2007 and 2016, we have a massive increase in the number of students declaring themselves as having poor mental health, going from 8,415 in 2007 to 49,265 in 2016. So why is that? Okay, so why is there such an increase in student mental health, in student mental ill health? Okay, now some of this I think is down to the fact that we're talking about mental health more, it's more in the open, people are much more likely now to come forward and say they've got a problem or that they're struggling. They're much more likely to actually disclose that they've got poor mental health. And I think, you know, that will account for some of the increases, but some of the increase also shows that maybe life is becoming more stressful, maybe students are finding things more difficult. So we need to take these statistics really, really seriously. And of course, when you become a student in university, you're going to go through some transitions. So you're going to experience academic transitions, social transitions, geographical transitions, and psychological transitions. So in terms of academic transitions, you're going to have to get used to new ways of learning, new ways of studying. There's going to be an expectation, for example, that you're more independent in your learning, but also new ways of writing, you know, so all this sort of new learning, and many of you will come from an education system, you're coming through the education system where you're used to doing exams, and then you'll come into university and you may be surprised, you may not have any exams during the whole of your degree. Everything may be based on coursework and modular assessments rather than learning everything and revising everything at the end of 2 or 3 years and then doing a big exam. We don't tend to do those big exams in universities. We tend to do modules, and then at the end of that module, you have an assessment, then you do another module, then you have an assessment. And lots of the assessment will be done through coursework, maybe essays, maybe presentations, and also placement as well. So it's a very, very different way of learning. It's a very different way of studying, and you have to adjust to that. You've also got to get used to meeting new people and forming new social relationships, meeting new friends, establishing those friendships. Many of you will be moving away from home for the first time, so you're actually moving geographical location into a new area. And many of you may experience psychological transitions. So you may experience changes to your well-being when you come to university, hopefully in a positive way rather than a negative way. But the point is that you're going to experience all of these transitions, and many of these transitions will be going on at the same time, and you're going to have to adjust to all of these different kind of expectations and transitions. And when you have positive transitions, that really supports your mental health and well-being. But if the transitions are not positive, that can impact on your mental health and well-being. And we know that for students, there will be busy times of the year, for example, exam time or coursework time when you've got to hand work in. You may have to move house. You may have to learn to manage placements. Okay, so you might be juggling an academic identity as a student and learning to be a university student. But then you may also, for example, if you're training to be a teacher, you're also developing at the same time a professional identity as a teacher, and you're going into schools and you're working with children and you're being a teacher. So you're navigating those different identities, and you're jumping between those identities. You're jumping between an academic identity or a student identity and also a professional identity as well. And this can be difficult. Some students experience loneliness. And many students have incredibly high expectations of themselves, because many students who go to university are perfectionists. They want to do well, they want to achieve, they want to get a good degree. And those expectations can sometimes trigger mental health problems. Okay, so there are lots of factors that can affect your mental health as students. Now, this is an interesting psychological theory by Mayer. It's called minority stress theory. And it looks a bit complicated, and I apologise for the not very good print on this model. But what this model says is that everybody experiences something called general stressors. We all experience general stressors in our lives. It could be to do with relationships, or friendships, or family, or finances, employment. We all experience general stress. But Mayer said, if you are an individual belonging to a minority group, so this could be LGBT, it could be disability, it could be race, it could be gender. So if you have a minority status, Mayer said that you experience 2 more levels of stress on top of the general stress. So Mayer divided those 2 levels of stress into what are called distal stressors and proximal stressors. So distal stressors are when individuals from minority groups encounter prejudice, discrimination, maybe violence, maybe harassment because of their minority status. Proximal stressors are when those individuals from minority groups anticipate that they will experience those bad things. They anticipate that they will encounter prejudice. They anticipate that they will encounter discrimination and maybe harassment. And that anticipation that something bad will happen can lead to negative mental health outcomes. So we need to be aware that individuals in minority status can experience additional forms of stress on top of the general stressors. Okay, so things that are different at university. So there will be increased expectations of independence. You'll have to manage independent living. You'll have to learn to manage your money. You'll have to learn to manage your timetable and your studying and your study schedule. And you'll have to learn about the academic conventions of academic writing, for example. And many of that is very different to what you're used to. Much of that is very different to what you're used to. Things that you can do, right? Talk to people, build friendships, talk to people, develop a nice circle of people around you, a nice social circle that you can talk to, and do talk about how you feel. You'll have a personal tutor who supports you. Talk to your personal tutor, talk to your course leaders, talk to your family. Talking about how you feel is a massive step towards solving the problem. So talk about how you feel, okay? And actually acknowledge that how you might be feeling when you move to university is quite normal. Many people experience homesickness, for example, for the first time. So, you know, your feelings, chances are it won't be just you feeling like that. Other people will also be feeling like that. So talk to all of those people, talk to your personal tutor, talk to your course tutors, talk to your family, engage in physical activity. So make time for physical activity. Okay, that's really important. That will support your mental health. Volunteer. So get involved in things on campus, get involved in initiatives, you know. So if there's a student ambassador scheme, for example, get involved in that, because that will support your mental health, it will support your well-being, but it will also support your CV, and make you very employable at the end of your degree. All universities have a student wellbeing service that you can access, so you'll be able to access the student wellbeing service if you feel that you can't manage the situation. Okay, don't be afraid to access student wellbeing. It's there to help you. However, remember, for most students that university is an enjoyable and life-changing experience. Okay, so you're not going to leave university being the same person that you started out as. It's going to significantly transform you. It's going to change your life. Okay, it's going to enable you to access opportunities after you've left university that you wouldn't have been able to access. It's going to lead to an amazing life experiences, and it will be life-changing, and you will always probably look back at your university time and really remember the best parts of it. So it's going to be an amazing time. We're just going to move on now and focus on mental health in school. So I'm just conscious of time. Okay. So this is the whole school approach to mental health. And this model is Public Health England's model. So this was Public Health England. They developed this model in 2015. What this model shows is that the leadership and management team of the school play a critical role, a central role in driving this forward, in championing this work, in making sure this work takes place within the school. And what we can then see is there are different strands to the whole school approach. We've got a strand that deals with the ethos and the environment of the school, a strand that deals with curriculum, student voice, staff development, identifying need, working with parents, and then referral. Okay, so what I'm now going to do is take you through each of the strands of the framework. Okay, so the leadership and management team of the school should be championing mental health and well-being, and they should be making it a really key strategic priority in the school. There should be a named member of staff within the school who's actually responsible for mental health provision within the school. And there should be a named governor, a named school governor, who's also responsible for monitoring the school mental health provision. There should be policies in the school that deal with staff wellbeing and pupil wellbeing. And there should be clear systems for tracking and monitoring pupil mental health and wellbeing. And the leadership team should be investing in staff training to actually support staff in identifying children with poor mental health needs. Okay, so I think anybody who goes on any education course should be learning about what is the role of schools in supporting children's mental health. Now, what we know is that the ethos and environment of the school, so the ethos of a school is basically when you walk into a school, you can feel the ethos. You can feel, is this a positive place to be? Is this a happy place? Will I thrive in this place? Okay. So when children go into a school, it should be a positive school culture. They should experience a sense of belonging. Okay. because once they experience a sense of belonging, they feel connected to the school, and that will support their well-being. And it should be a place where diversity and individuality is celebrated and embraced, okay, so that they feel totally this sense of belonging, and that their identities are made visible within the school community and within the school environment. We need to provide children with a mental health curriculum. Okay, so this is not just me saying this, by the way. Ofsted also say that all schools should be providing children with a mental health curriculum. So this is a curriculum that educates and teaches children about mental health. It teaches children how to be mentally healthy. It teaches children how to manage mental health conditions, such as anxiety, for example, or stress, or depression. Essentially, this is a curriculum that reduces stigma. It reduces the stigma associated with mental health, because what we're trying to do is reduce that stigma and get children to understand that they can talk about how they feel, because actually this is quite normal. We all have mental health. Okay. It's a curriculum that teaches children how to be mentally healthy, but it's a curriculum that also provides lots of opportunities for outdoor learning and physical activity, because outdoor learning and physical activity will absolutely support mental health. Okay. But also it's a curriculum that provides children with volunteering opportunities, because volunteering, either volunteering in school or volunteering in the community, will also support mental health, because volunteering is one of the 5 ways to well-being. Okay, so it's the act of giving somebody something free of charge without expecting something back. Basically, providing a service is one of the ways towards well-being. Okay, so we should be absolutely providing children with a mental health curriculum. Okay, so here's an example of a research study that I was involved in Cambridge. Okay, so what we did was we worked with Cambridge United Football Club, and the football club trained up some of their staff, and those staff went into the schools, into all the schools in Cambridge, into every single secondary school in Cambridge, and they delivered a mental health curriculum to all children in year 8 and year 9, basically. Now, what the children loved was the fact that this curriculum was delivered by the football club, not by their teachers. They built a relationship up with the staff. They got to know the staff. They loved the fact that footballers came into lessons and they talked about their own lived experience of mental health. So the footballers came in and they spoke about their own experiences of depression, their own experiences of, being a footballer and having to perform and needing to be the top of your game, and the pressure, of having to perform on that level all the time. And the children loved it because these people were their role models. So they loved the fact that these footballers were coming in and talking about mental health. But essentially what you can see on the mind map is the children were learning, as part of this mental health curriculum, they were learning strategies to manage their mental health. So what you've got here is the children came up with a whole list of strategies on how to manage stress. Okay, so you've got things like watching a film, doing some deep breathing, going for a walk, okay, socializing with friends, doing physical activity, listening to music, lots of different ways of managing mental health, because actually this is what a curriculum should be doing. It should be giving children strategies to manage their own mental health. And actually what the children were able to do at the end of this curriculum is they were able to say, actually, not all stress is bad. Some stress is good. Okay, because actually, if we have if we have stress, it means that we have goals to aim for, goals to achieve. It keeps us focused. It helps us to drive ourselves forward. It motivates us. They were actually saying some stress is good, but it can become bad when it stops you from functioning. So when the pressure gets so much and you can't function and you can't make a contribution, then that's bad stress. So the children were able to differentiate between good stress and bad stress. They were also able to talk about things like they were able to talk about the pressure on boys, particularly the pressure on boys, to not talk about how they feel. So some boys, for example, feel this intense pressure not to talk about how they feel, because they're living up to stereotypes around being male, and this idea that because they're male they shouldn't show their emotions or feelings and so on. And actually that's a load of rubbish, isn't it? Everybody should be talking about how they feel, and of course boys should be showing their emotions and sharing their feelings. But actually what the children were able to say is there is these stereotypes around being a boy and around being a girl, and people live up to these stereotypes, and sometimes these stereotypes actually stop people from talking about how they feel. And the children were saying, this is wrong. We shouldn't be having these stereotypes. Boys should absolutely be, talking about how they feel. They should be expressing their emotions. They should be able to talk about their mental health. And I thought it was brilliant that the young people were able to have those discussions. Right, now the best schools, the very best schools that are doing really great innovative work in this area, are getting children to lead on this. They're getting children and young people and students to become leaders of mental health. So for example, they're training children up to be mental health champions or mental health ambassadors. They're doing peer mentoring schemes where students are trained up to become good peer listeners. We're developing a similar scheme in my university where we're training students up to be mental health ambassadors or mental health champions, because often young people would rather talk to young people about how they feel than talk to an adult. Okay. So there are some brilliant initiatives in lots of schools now where children are really taking charge of this, and they're doing peer listening or peer mentoring. Some schools are developing the role of the equality ambassador. Okay, in some schools, students actually are leading workshops, and they're putting workshops on for staff and for the rest of the students. So students are really taking this forward, because actually this is an issue that's really important to young people. So why not get young people, why not actually give them some agency and get them to lead on this? Because it's something they're really passionate about, and actually they'll do it with us, with the educators, but actually they'll do it with us and they'll support us and they'll take it forward. Okay, so in one school that I worked with, they had an LGBTQ student group that was for LGBTQ plus students and their allies. So it wasn't just exclusively for LGBTQ plus students. And what the students did in that group was they did some amazing work. So they audited the school environment, and they went round the school environment and they looked for evidence that the school was being LGBTQ plus inclusive. They went into the library and they reviewed the range of reading materials available in the library. They sat down and they worked with subject leaders and curriculum leaders, and they reviewed their curriculum plans to look to see if LGBTQ plus inclusion was being embedded into the subjects in the curriculum. Okay, they audited or reviewed the bullying on the playground. They did some brilliant work, and actually the students then fed all of those issues back to the senior management team. So the students then met with the senior managers and with the governors, and they said, right, this is the work we've done. These are the issues that we've identified. This is the outcomes of our research. So my argument is that we should be getting students to be researchers. Students should be researching these issues. They should be active agents of change. They should be leading on these things as well as teachers. And they should be taking, a really they should be sitting in the driving seat, taking this forward. Okay. Staff development is part of the whole school approach. So all staff need training or professional learning in how to identify poor mental health, how to manage their own mental health, and also how to have conversations with children about their mental health. Staff well-being is part of the whole school approach. So many schools are now thinking about how do we support staff with their well-being. This isn't just about the students and the children, this is about staff as well. That's part of the whole school approach. But what we know from some of the research is that teaching, for example, is a really highly stressed profession. Many teachers are stressed. I've given you some stats there. Senior leaders are also stressed, and far too many people consider leaving teaching or leaving education early because of the pressures. Okay, so we need to get better at supporting staff well-being, and many schools now, many schools, this is a really key priority within the school to support staff, because actually if staff are not feeling that they're in a good place, how can they support students? Okay, so school leaders have to pay attention, or must pay attention, to staff well-being. Really important. Schools also need to get better at identifying children with mental health needs. Okay, now it's all well and good having a system that is reactive. So some schools just identify children who demonstrate changes in mood or changes in behaviour. So they'll look for sudden changes in behaviour or sudden changes in mood, which maybe indicate that the child may have a mental health need. But my argument is that's not sufficient, because that's just reactive. There may be many children with poor mental health who don't show any changes in mood or any changes in behaviour. They may appear to be functioning as though they're absolutely fine. So we need to have a system called universal screening, where all children go through some kind of screening process, basically. One of the examples is where students complete questionnaires that ask them about their well-being, questionnaires that ask them about how they're feeling, about their life satisfaction, about their resilience, questionnaires that help educators to potentially identify any particular issue within a child. Part of the whole school approach then is working with parents. Many parents may also have their own mental health needs. Many parents may need to be signposted to support within the communities and to organisations that can help them. Parents may also benefit from workshops that raise their awareness of mental health and also help them to support the mental health of their child at home. But this is not an easy thing to address, because if you're working in some schools, we've got to be aware of cultural values and cultural views around mental health, because in some communities, mental health is still very much stigmatized. It's still very much something you can't talk about, something that's brushed under the carpet. So schools need to tread carefully to break down some of those conceptions around mental health. Okay, so schools will need to provide intervention. Okay, so what you can see from the diagram here is that all children need a mental health curriculum. all children need a positive environment, okay? And all children need a mental health curriculum, but some children will need psychosocial interventions and some children will need to be referred for specialist mental health support. Okay, so it's just showing the different levels of interventions. I would argue that all children need a mental health curriculum. Some children need specific interventions in school and some children need to be referred onto specialist support. Breaking down the stigma, so getting children to talk about how they feel is something that schools can do literally overnight with no cost. They can just break down that stigma and get children to talk about how they feel. These are some examples of screening kits that you can use, that schools can use. So these are wellbeing measurement frameworks, one for primary schools, one for secondary schools, and one for further education. And those are examples of the questions that students can complete. So how are they feeling? Are they feeling optimistic? Are they feeling useful or relaxed? These help teachers, if all children go through this kind of screening process, this helps teachers to flag up any particular issues and make sure that children don't go under the radar. But of course, it's only as good as how children feel on that particular day when they complete the questionnaire, and it's only as good as if they've got to be honest when they fill them in. If they just write anything, if they lie when they fill it in, it's not going to be useful. Okay, so it does rely on students being honest. And I'm just going to flag up, this is another psychological theory. I like my theories. Self-determination theory. So some of you may be familiar with this if you've done psychology. So this is the key to human flourishing. Right, so this theory developed by Decky and Ryan in the 1980s has stood the test of time. Right, so it basically identifies 3 components to overall well-being and overall flourishing. So it says, if we have autonomy, if we're made to feel competent, right, and if we develop something called relatedness or connectivity, for example, social connectivity, or connectivity to an organisation, such as a university. If we have all of those 3 things, we flourish, okay? And our well-being is probably going to be in a good place and we will be motivated. Decky and Ryan said that if one of those things is missing, then we don't flourish. So we actually have to have all 3. And all of those 3 components will enable us to absolutely thrive. So that's the key to human flourishing. Okay, thank you very much, everyone. I'm going to stop sharing. And I'm going to take some questions now in the chat. If you have any questions about anything that I've just discussed with you, do you want to pop them in the chat and then we'll take it from there?
So I wonder, Jonathan, if you could just share what your one sort of overarching piece of advice would be to incoming students to university sort of this coming year in terms of their maintaining that mental health and well-being.
So I think first of all, remember that things will be quite new at first. So if you're moving away from home, you're moving into a new town or a new city, you know, it's a whole new way of life. You're meeting new friends. You're going through all those different transitions. I think give yourself some time to adjust. Don't expect things to fall in place straight away. Okay, many people will initially feel a bit lonely or a bit homesick. That's perfectly normal. So just give yourself time to adjust. You know, I remember when I first went to university, I absolutely hated it. I felt really, really lonely. I didn't know anybody. Nobody seemed to want to talk to me. But actually, after a while, everything fell into place and things were much, much better. So give yourself time to adjust. I think don't expect to be perfect in terms of like your academic marks. So don't put pressure on yourself to achieve, you know, like 80%, 90%, 70%. Just give yourself time to adjust, because actually you've got 3 years to improve. And in many universities, although you have to pass your first year modules, in most universities, your first year degree marks, your first year assignment marks, don't actually influence your degree classification anyway. Most universities, they take your second and third year marks. You know, so I think just give yourself some time, take some pressure off you. But I think also keep in regular contact with your personal tutor. Talk to your personal tutor about how you feel. Talk to your course tutors. Everybody is here to help you. Everybody wants you to succeed. Everybody wants you to achieve. Nobody wants you to drop out. Nobody wants you to fail. We all want the same outcomes, which is for you to basically progress through your degree, to be happy and to get a good degree at the end of it, and to go into a job at the end of it. So everybody wants the same thing. Everybody will be here to help you. So the key thing is talk to people, I think. So find a group of people that you can talk to. Okay, develop a small group of people that you kind of really, really trust and that you really connect with, but also talk to your personal tutor. Keep that conversation going with your personal tutor. Talk to people back at home. I mean, the brilliant thing nowadays, very different to when I went to university, when we couldn't keep in touch with people as easily. You can just keep in touch with family and friends back home on social media, can't you? And on WhatsApp. It's so much easier now just to keep in touch with people. So just keep in touch with people, keep talking. If you have any questions about anything that you're not sure about, don't think, oh, that's a stupid question, I shouldn't be asking that, I should know this by now. Ask any question. You know, chances are, if you want to ask that question, if you need to ask that question, there'll be a load more other people who also need to ask that question, but probably aren't asking that question. So don't worry about asking questions. My top piece of advice is to reach out and ask for that support, really, and don't feel bad for doing that, because everybody's there to help you.
Thank you. And we've actually had a question come in since you've been answering that one. So someone has said they're worried about leaving for university because their sister is going through a really tough time, and they're just worried that leaving will leave them without support. So I wonder what your advice would be for people that are perhaps leaving family members that they are personally supporting, and what the impact might be, and how they can navigate that situation.
Yeah, thank you for that. I think it's really, really difficult if you're leaving behind people who need support. I think it can be tough, but I think that 99% of the time, the people that you're leaving behind actually want you to progress. They want you to go to university. They want you to achieve and achieve your ambitions. And you know, they actually don't want you to stay behind, because they want you to achieve your life goals. So don't feel guilty about that, but just keep in touch with them, keep checking in with them. You know, just keep checking in with them and see how they are. I mean, it's so easy now to keep in touch with people, but don't feel guilty about progressing and going to university and achieving your goals. Because actually that's probably what they want you to do anyway, and that's what you should be doing. But I understand it can be really, really difficult, but you should do that. You should go to university and get on with your life, but don't forget the people behind and keep checking in with them, I think. And good luck, everyone, and enjoy it. It's a really, really exciting time in your life, so just enjoy it, make the most of it.